Imagine living for months with intense abdominal pain. You have done blood tests, scan, even seen a specialist, but everything comes back normal. Still, the pain doesn't stop. The treatment doesn't work. Some days it's so bad. You cannot work. You cannot sleep. Doctor says there is nothing wrong. But you know there is. You feel it every day. Some patients even undergo surgeries, appendectomies, exploratory procedures, only to find nothing. No clear cause, no explanation, just more confusion, more suffering. If this feels familiar, this is your video. Hi, I'm Dr. Katia Batista, psychiatrist, and today we will talk about a psychiatric condition that is often misunderstood, somatic symptom disorder, where psychological distress manifests through real, persistent physical symptoms. Somatic symptom disorder, as defined by the DSM-5, involves or more somatic symptoms that are distressing or disruptive daily life, excessive thoughts, feelings, or behaviors related to the symptoms. Symptoms may shift or change in intensity over time, but the suffering is constant. It's not faking or malingering. The symptoms are real and the distress is genuine. Let me share a case. A 29 years old woman had persistent chest pain, echocardiograms, ECGs, all normal. Still, she couldn't breathe well, couldn't sleep, lived in fear of dying. Her anxiety grew. She isolated herself. Eventually, she was referred to a psychiatrist, not because the pain was not real, but because the origin of the pain was rooted in something deeper, unprocessed trauma and intense anxiety. What do these symptoms usually look like? In most cases, pain is the most commonly reported symptom. Chronic headache, stomach pain, back pain, chest pain are often present, but others may include unexplained fatigue, dizziness or shortness of breath, bowel changes, numbness or tingling, even visual disturbances. These symptoms are real, but they don't match any clear medical condition. What are the signs? The origin might be psychological. The symptoms change in location, intensity, or type over time. Medical test returns normal, but the discomfort remains or worsens. Treatments, even surgeries, don't relieve the symptoms. The distress leads to frequent medical visits, but not clear answers. Emotional stress or trauma seems to trigger or worsen the symptoms. This doesn't mean the person is imagining it. It means the body is expressing something the mind has not yet processed. So, what's happening? Studies show that Somatic Symptom Disorder is not simply about, like I said, imagining symptoms. If it often involves a complex interaction between early life experiences and brain functions and emotional processing. People who have experienced early trauma, neglect, or chronic stress may develop changes in how the brain or body responds to discomfort. This early experience can alter the hypothalamic pituitary adrenal HPA axis, the systems that controls how we respond to stress. Instead of calming the body, this system may become either underactive or overreactive, making people more sensitive to pain and physical symptoms. At the same time, areas of the brain such as the amygdala, which process fear and emotional responses, may become hyperactive. This can lead sometimes to misinterpret normal bodily signals as signs of serious illness. Some individuals may also have difficulties identifying and expressing emotions, a trait called alexithymia, or personality traits like high anxiety or perfectionism, which make them more likely to focus intensely on physical symptoms. This is not all in their head. These are real biological and psychological patterns that deserve compassionate and understanding and evidence-based care. Approach and diagnosis start with empathy. These patients have often felt dismissed. A medical workup is essential, not to prove them wrong, but to rule out real disease. Once medical conditions are excluded, the psychiatric approach begins. Building therapeutic alliance, avoiding confrontation, validating the patient's experience, gently exploring emotional and psychological stressors. Treatment is usually non-pharmacological at first. Psychoeducation, helping the patient understand the mind-body link. Cognitive behavioral therapy, CBT. I have talked many times about how this therapy works. Addressing, in this case, catastrophizing thoughts and health-related anxiety, mindfulness and relaxation techniques to reduce hyperarousal, supportive therapy to explore life stresses and emotional pain. The pharmacological treatment also is useful. SRI is a type of antidepressant. If anxiety or depression is prominent, that is common. Other types of this medication like SNRI, TCA, we can include it if it's needed. Let's talk a bit. What can someone do when medical tests keep coming back normal, but the pain and discomfort are still very real? Especially in settings where access to therapy or specialized care is limited, it's important to explore practical steps that empower the person to cope, heal, and supported. Here are some compassionate, realistic suggestions. First of all, acknowledge your pain is real. Even if no clear medical cause is found, the pain or discomfort is not imaginary, it's real and valid. You deserve support without judgment. Second, track your symptoms. Keep a simple journal, noting when symptoms arise, what seems to trigger them, and what helps relieve them. This can reveal emotional or environmental patterns. Talk to someone you trust, whether it's a family member, friend, nurse, or even a spiritual leader. Having someone who listens without dismissing your experience can bring emotional relief. Engage in stress reducing activities. Try gentle exercise, breathing exercise, listen to music, walking outdoors, or stretching. This helps regulate the nervous system. Avoid unnecessary repeated medical tests. This is important if your doctors have ruled out serious illnesses. Continuing to seek tests may increase anxiety. Trust the guidance once the evaluations are done. Learn basic grounded or CBT tools. If no psychologist is available, look for simple evidence-based tools online, such as breathing techniques or mindfulness meditation. Those techniques can help you. Connect with support groups, whether local or online. Connecting with others who have similar experiences can provide comfort and a sense of not being alone. And the last one, practice self-compassion. You are not weak or exaggerating. Your body may be expressing what words or emotions happen. Be gentle with yourself in this process. These patients deserve compassion, and healing requires an integrated approach, one that honors both body and souls. If you are a clinician, remember validating symptoms can open the door to real treatment. Living with unexplained physical symptoms can feel overwhelming and isolating, but you are not alone. Understanding the connection between mind and body is the first step towards healing. If you or someone you know is struggling with ongoing physical discomfort that lacks a clear medical explanation, seek support. Compassionate care exists and there is hope. To learn more about this condition and other mental health topics, watch the full video on my YouTube channel, Your Mental and Emotional Well-Being Matters. Thank you.